to make a quick remark, and he'll then invite the country director. Karibu.
Thank you, Madam CS and DG. We as World Vision Fraternity, and in particular World Vision Kenya, are grateful to be here today with the government, accompanying the government in the response initiative for this terrible scourge. Before I go to the items that we wish to hand over to the government, I want to say two things. The first is that we are in solidarity with the government in terms of all the preventive measures that have been put in place to combat this scourge. We appeal to all the citizens in the country to heed to those instructions because it will save lives. The second part is on the issue of domestic violence that we see in many parts, even though isolated, but the concern of some elements of domestic violence, especially on children, that is disturbing, and especially also mothers. So we are calling upon the Kenyan fraternity and the community at large that please let us protect ourselves, our neighbors, our families, the communities at large. Please let us protect the children and the mothers and all the vulnerable communities in the country at this time that we are putting into practice social distancing and all the other measures that have been put in place. Let us not take advantage and start abusing children and people who are in need. So that is absolutely critical. But I wanted to say, Madam Kaz, that the level of partnership that we have with the government of Kenya is untested. We are grateful for the partnership as World Vision Fraternity, and we continue to accompany the government and the people of this country to combat this scourge. So thank you very much for this partnership. We are holding hands together, and together we shall conquer this scourge. At this point, allow me to invite the National Director for World Vision Kenya to say a few remarks, and will tell us exactly what level of contribution we are making today to the government and to the Minister of Health to help in the fight of this scourge. So Lilian Dozo is our National Director for Kenya. My name is Stephen Omola, as the Vice President of World Vision in East Africa region. So Lilian Dozo, please, you're welcome.
Thank you.
Thank you very much, Stephen. Madam CS, thank you so much for this opportunity. First of all, I'd like to commend and applaud the government of Kenya, and through you, the Ministry of Health, for the commendable efforts that are underway to really combat this scourge of COVID-19. I'd like you to know, Madam CS, that you have a strong and strategic partner in World Vision Kenya. We'd like to affirm our commitment to continue working and partnering with the government in this fight against COVID-19. And it's a fight that we believe will be won as we see the great efforts that are underway. To this effect, World Vision Kenya has today donated 11,416 PPEs, which are worth over 50 million Kenya shillings, to the National COVID-19 Emergency Response Committee. This is really our way of supporting all the efforts that the government of Kenya has put in place. And the kits comprise of surgical masks, shoe covers, scrub bottoms, aprons, and coveralls. It is our hope that this equipment will really go towards protecting our frontline workers, whom I'd like to also thank this morning for all the wonderful work that they are doing to protect Kenyans. At the county level, CS, World Vision has already dispatched PPEs to the tune of 52 million Kenya shillings in total, and we continue to partner with counties to make sure that we also contribute towards their efforts towards combating COVID-19. As you know, CS, World Vision is present in 37 counties out of the 47 in Kenya. We are a community-based, child-focused organization that seeks to ensure the well-being of vulnerable communities with a special focus on children. So aside from the support offered to the health sector, World Vision is also working to lessen the impact of COVID-19 amongst vulnerable children and families through the provision of cash transfers that can be used to buy food and other essential items. We all know that there are so many communities that have been impacted by COVID-19 and their incomes have been eroded. So this effort to embark on cash transfers is aimed at ensuring that we help to alleviate that suffering. Most importantly, we are keen, CS, on working with the government and other key stakeholders to protect children from abuse or violations of their rights, especially during this COVID-19 pandemic. We've all read reports that domestic abuse and especially violence on children is on the rise. So we continue to support awareness creation to make sure that children are protected. And we'd like to request the National COVID-19 Emergency Response Committee to consider developing specific COVID-19 child protection standards of operating procedures that integrate child safeguarding guidelines. I thank you, Honorable CS, for this opportunity.
Thank you, Madam County Director. And I think the NERC and the Ministry of Health do take very big notice, one, of your strategic partnership, and two, of our call to action to pay attention to domestic abuse, and especially in safeguarding our children. And so we shall endeavor to do this. The DG is here and his team, and I'm sure they will work on the required protocols. I think now I'd invite